All right. Well, welcome everybody. Welcome to today's Charm Health Wednesday webinar. I'm Ranjini Rangan, your host, and I'm thrilled to have you all here. Joining me is Megha Danta, who will help facilitate this session. And we have two wonderful guests today from VitaminLab who we'll talk about in just a second. Today's webinar is titled Creating a Truly Personalized Formula, where we'll dive into the world of personalized nutrition with VitaminLab. A bit about VitaminLab. They're leading the way in personalized nutrition, making sure everyone can supplement based on their specific needs, goals, and lifestyle using actionable health data. Their unique interface allows practitioners to create all-in-one supplements tailored specifically for their patients. VitaminLab sources over 200 professional-grade ingredients from trusted suppliers worldwide. All their formulations are made without fillers or binders in their NSF GMP certified lab in Canada and undergo rigorous testing. We're excited to have Dr. Lydia Thurton. Did I pronounce her name correctly?
Yes, thank you.
Wonderful. And Sarah Etkin.
Hi, everyone.
Yes, wonderful. They'll talk to us about the CharmHealth and VitaminLab partnership and show how providers can use this integration to create personalized supplements for their patients. We have rolled out the CharmHealth EHR integration with VitaminLab, and we're very excited to be able to showcase their webinar today. Here's what you can expect from today's session: how the CharmHealth and VitaminLab integration works, how to formulate supplements using predefined protocols, how to create a custom formula from scratch, how personalized formulas can enhance patient adherence and outcomes. A recording of this webinar will be available later. For all the registrants and attendees today that are attending today specifically, VitaminLab has a really awesome offer. Really glad to see you all. If you have any questions after the webinar, feel free to reach out to VitaminLab. VitaminLab will share their contact details, and we will also be available at support@charmhealth.com. Okay, well, with that, let's get started and explore how CharmHealth and the VitaminLab integration works and how we can transform personalized nutrition for your patients. Over to you, Sarah and Lydia.
Hi, everyone. Thanks so much for joining me. I'm Sarah. I'm the practitioner success lead here at VitaminLab. I'm also a registered holistic nutritionist and really excited to be part of this truly innovative partnership here and to be able to present this all to you today. I'm going to be passing it off first to Lydia, who's going to be speaking about all the benefits of a truly personalized vitamin. And then after that, I'll take you through the full integration, show you how to create a personalized supplement, either based on our pre-formulated protocols or a truly unique formula based on your knowledge of your patient's health history and what's indicated for them specifically. So Dr. Lydia, take it away.
Hi, everyone. Really happy to be here with you today. I think what I'm most excited about is how truly innovative this partnership is. This is the first time that a practitioner has been able to formulate a truly personalized supplement from an EHR platform. And on top of it, we can private label for you. So all of the hard work that you've done with branding, developing your look, your logo, working with a designer, we can create beautiful packaging for you to produce these wonderful supplements for your patients that are truly personalized to their unique health concerns. So really what we're looking at here is a win-win situation. That's what we're all about here at VitaminLab. We want our practitioners to win and we want the patients to win. We really want everybody to just all ships rise with the tide kind of thing. So when it comes to practitioners, we're looking at a consistent additional revenue stream. So no longer are you competing with Amazon and Target for supplement sales. This is something that your patients cannot find anywhere else. We're looking at about 30% improved compliance when we're creating an all-in-one product and there's not different bottles happening with different supply lengths, 30 days, 60 days. It's just easier for patients and you'll see that they follow through on your supplement recommendations. We're looking at a streamlined workflow. That's the whole point of working with Charm and their wonderful EHR system. And you can formulate right from your portal. We're looking at growing your practice through word of mouth. So personally for myself, I find when I formulate something personalized for my patients, they talk about it. They feel really special. It's just, it feels like I really get them because I prescribe something personalized to them, and inevitably they tell other people. And word of mouth, in my mind, is always a great way to build your practice because people really trust that. And exclusive offerings and private labeling. So again, you can put your unique logo onto the product, and really you're the one doing the hard work putting it together. So, we love that for you. And when it comes to patient benefits, which is, of course, the most important thing, you're looking at personalized care. So you're able to tweak the dosages, get the ingredients just right, look for synergies, ways to combine ingredients, and really move the needle on patient health concerns. So you're getting at better results because they have improved compliance and they're really happy with their product. It's more convenient. It's really a disaster for patients when they have 6 bottles going on and things running out at different times. It's just so much easier if it's an all-in-one. And they get to save money by combining and having that all-in-one product. So this is really what we're talking about. This is the number one problem that VitaminLab is solving for. It's that supplement fatigue. So somebody's on a multivitamin and they're taking magnesium for sleep, or they're on their adaptogen, or they're not digesting well, so they have their digestive product. We all have patients that have that graveyard of supplements in a medicine cabinet or a kitchen cupboard where they bought all these different bottles. They forget why they're taking them, and they inevitably end up wasting a lot of money and time. So when we're creating that all-in-one formula, we're just, it's less mental effort for them. We're just giving them what they need to take, and they can follow through, no questions asked. So with VitaminLab, you're able to get custom dosing. So you're able to tweak up and down the doses. You're getting that all-in-one formula. We can do really easy refills for you where things can go into auto production. So you can kind of have a hands-off approach if you'd like that. And once your patient reaches a certain health goal, say they're sleeping better, or their digestion is improved, you can pull back on some ingredients and maybe shift the focus of a supplement really easily. And comparing to other situations, we're just seeing it can be quite chaotic for people to piece together a different supplement regimes with different bottles with different supply lengths. And even knowing what brand to take, it's really difficult for patients to kind of weed through the noise sometimes. So really, we're talking about a 1, 2, 3 situation here. So we're integrated in with Charm. So you're just going to allow that integration to take place, give permissions. You're going to formulate directly in your patient records, and then you're going to finalize the formula with VitaminLab, and we're going to do everything we can to put the product together in our beautiful lab and get it shipped out to your patient effectively. So there are 2 ways to formulate. We have curated protocols for you. So our team of nutritionists and myself, a naturopathic doctor, we're always working on creating really smart blends of products. And certainly working with us, you're able to create your own protocols as well. And you can also build from scratch. So if you have products that you've always envisioned or products that you like, now you can make them yourself, and you can put your own label on them and retail them to your patients. And I want to emphasize that our protocols are designed with real people, real problems in mind. So whether that's antioxidant and cardiovascular support, whether that's insomnia and menopause support. Actually, do you know what? There's not a product on the market that combines insomnia and menopause together. So even that is a wonderful personalized product. And say hair loss, you can have your own hair loss product. So a lot of our patients are turning to Nutrafol and things of that nature, but now you can create your own mix or use the one that we've created for you. So we like to give case studies because that really drives the point home. And a patient like Priya, I'm pretty sure, like if you're a functional medicine practitioner, you've had a patient like this for sure. So she comes in, she's perimenopausal, 51 years old, she's having insomnia and night sweats, and she also has constipation. So, hallelujah when we have a patient that only has one single itty bitty concern, but let's be honest, that's not the majority of our patients. They are coming in with sometimes even a laundry list of different concerns that they'd like addressed. So with VitaminLab, we can piece things together. So in this case, she tells you, I'm so frustrated. My husband's beside me sleeping like a rock, and I'm staring at the clock or I'm sweating through my pajamas. Like, it's just so frustrating for women when their hubby is just sleeping so peacefully and soundly, and they just cannot get a wink. And then she tells you ever since she's a little girl, even though she's vegetarian, she still struggles to go every day. So and we know that, GI and having constipation, like, that impacts your hormone detox pathways. So, anything we can do to heal the gut and get her hormones, get her sleeping again. And then on top of it, like many of our patients, they're taking that vitamin D or a magnesium or a K2 because they want to, support bone health. So how are we going to piece this together? Well, with VitaminLab, you can. So you can choose from our protocols. You can pick the sleep support protocol. You can pick the menopause support protocol, which, by the way, does not exist. So you can put those two together. You can offer a digestive support. And then if you want that little bit of vitamin D and K2 too, you can easily layer that on. And now you have a beautiful product that really speaks to Priya's chief concerns and, has wonderful synergy too, because people, your digestion's not great. You're not sleeping well. Like, she's just going to feel so much better on this product. And as you can see from the images, you can private label it, or you can use the VitaminLab product as well.
So we're going to take a
let's see how it works
here to have a poll. So you can see in your chat to have a poll, answer those questions, and then after that, we're going to see how it all works. I'll share my screen on how to access that integration within the CharmHealth account.
Just one sec as I get that poll running.
Okay.
I think I'm seeing the poll on your screen. It's not. No, it's my screen. Let's see. Oh, here we go. There we go. All right. If you can take a moment to answer this poll, it would give us some insight. Would appreciate it. We'll give about 40 seconds more to answer. And thank you all for attending today. We've got a great audience. Okay, we'll give it another 10 more seconds and then we'll close this poll. All right. Well, thank you so much for answering that poll. We're going to, give this back to Sarah, our Lydia. I think it's now Sarah's turn. Thank you so much.
Now.
Thanks
yeah.
for answering this.
Thanks for Lydia for really just outlining exactly how that looks in your practice when you're seeing a new patient. They have multiple concerns. Now I'm going to show you how to bring that to life in terms of a personalized product. So I'm sure you're all familiar with this homepage here, the CharmHealth EHR homepage. To access the integration, first you're going to go to the settings page here. You're going to look for the VitaminLab link, click on VitaminLab, and then read through the notes here. I agree to connect with VitaminLab and choose the orange button. You'll see your status should be active here, and that will mean that you'll be able to access your integration directly through your CharmHealth EHR. So the first thing I'm going to do is go to the Patients tab. So you can see Priya is already here as a patient. I'm going to click on Priya and then add a new encounter. So let's say I'm just seeing Priya right now today. I'm going to add a new encounter with her so that I can take notes on our call and then choose my supplement as my treatment plan. So we'll scroll down to supplements here, click on the Add Supplements button and choose VitaminLab. So this is our really wonderful integration pop-up that you'll see where you can truly customize it directly in your CharmHealth EHR. So with Priya, we were looking at some menopause support. So there's two different ways that you can search for any ingredients in here. You can search for it by protocol name. So you can just type in menopause and the menopause protocol will appear here. So I'm going to choose that. And then we were looking at the sleep protocol. We'll add this as well. And then we were looking at the digestive support. And we'll add that. So now we've added all three of those protocols. If there's any other ingredients that you're looking for specifically, you can always type it into this search box. Let's say coenzyme Q10. You can just type in coenzyme and it'll populate all the protocols that VitaminLab has to offer that contain that ingredient. So you can browse through and add anything else that you'd like as well. From here, I'm going to review the formula. So we'll click this orange button. We will add a formula name. Typically, we like to add the patient's first and last name. And then we'll choose our dose type. So with VitaminLab, you have the opportunity to choose either veggie capsules or powdered form for your supplements. I'm going to just stick with veggie capsules here. That will be the default. And then for your duration of supply length, you can truly customize that as well. Minimum supply length offering is 60 days supply and maximum is 180 days supply. Again, the default here will be 90 days or 3 months. From here, you can review all the ingredients that are included in this formula. I'm going to, let's remove valerian, and I'm just going to reduce L-glutamine to 750 milligrams. Then we can recalculate the price. And it's good to note too, if you do add multiple protocols that have duplicating ingredients, those dosages will just simply be added together. There would be a little info icon here that if you hover over it, indicating that that ingredient was duplicated, so you can see right away which ones were added together. At the bottom of this formulating page, you'll see our 2 different billing options that we have available, as well as right away the daily capsule count. So you'll be able to see, let's say if you added, 5 or 6 different protocols together and it ends up being, 8 capsules per day, you can then go in, delete any ingredients, adjust any of the dosages, and then click on that recalculate price button just to make sure that it's within a daily capsule count that your patient will be compliant with. So lots of flexibility here. We have a patient pay option for billing, which is a monthly retail price. Built within this monthly retail price is a 25% margin to you. So in this case, the patient would pay VitaminLab directly $120 per month for the duration of their supply length. So this is a 3-month supply. It would be 3 payments of $120, and then you would get a 25% margin payment from VitaminLab. This is flexible. If you would like to adjust that margin at all, just let us know, let your account manager know, and we can help you out with that. The second billing option that we have is our clinic pay option. So this is the wholesale cost for the entire 90 days supply. And then you have complete flexibility to charge your patient in office or invoice them online for whatever margin that you'd like. So the benefit with these 2 options is you don't have to choose one or the other. Each time you're ordering with VitaminLab, you can choose which one is best for you or for your clinic. Once we are done finalizing the order here, I'm going to just choose add and transmit to VitaminLab. That will add each of those ingredients and the dosages right into that patient's chart notes. So that will be available for you to review or see back when you're ready. By clicking that add and transmit, this will bring you to your VitaminLab account. So if you haven't already created an account with VitaminLab, we'll provide a link for you to access our registration page so that you can create an account with us. It's completely free. You'll get a $100 credit automatically added to your account. And actually for attending this webinar, we'll add another $25 for you as a little benefit. So Once you're logged into your VitaminLab portal, it'll bring you directly to your portal here. Copy that formula over. You can review it once more here on this page. But I do recall as well for Priya that we wanted to be adding some additional D3 and K2 for her bone health. So we don't want her to be taking that on the side. Let's add it into our formula. So I'm going to click on this edit button. This will bring me to your formulating page or VitaminLab's formulating page. So you can make any other adjustments that you'd like to this formula here. When I scroll down in this middle section, this is where you can access VitaminLab's 250 professional grade ingredients. So anything that you'd like. So if we want to be adding D3, I'm just going to type in D3. You can see we have a vegan option of our D3 and a regular option. I'm going to add the vegan option just because she said she was vegetarian. And I'll add it at 75 micrograms. If you're used to dosing in IU, we do have a little conversion chart right here to help you convert it into a microgram dose. And then I'm going to type in K2 and add 45 milligrams or micrograms of K2. You can see we have a standard dose amount that's listed to help you in formulating. If you're unsure of, what to dose for that specific ingredient, this is a really great place to start. So you can just click that add button and it will automatically add 45 micrograms to the formula summary. So we've got D3 and K2 now added here as well. There's a few different features that you can access directly in this formula editing page. You can search by condition, which is really helpful. So if we want some additional, stress supplements, women's health supplements, you can already see that we have 3 included in her formula. But if you want some more blood sugar balancing, that's available as well. If the patient is on any medications at all, we have this great new feature that will allow you to see which pharmaceutical considerations are, needed to be looking at in case you're concerned about that for a specific patient. So lots of great resources for you to ensure that you're creating a formula that's going to be incredibly powerful and effective for your patient. Now that I'm done updating my formula, I can click on this calculate price button. And that will update, if needed, the capsule count here, as well as the cost. You can see that it really didn't do much here in terms of a cost difference by adding those 2 ingredients. That's where we really start to see the true value of a personalized supplement when we're adding those multiple protocols together. Then we'll click on Buy Now, and that will bring us back to your formula editing page. You can choose your preferred billing method here. So if you choose the invoice to patient option, this is a nice hands-off approach. You'll enter your patient's name, phone number, and email address. And when you confirm that order, that sends an email from VitaminLab to your patient, letting them know that you have recommended a personalized formula for them. It shows exactly what's in it and then what their monthly cost is. If we choose the wholesale cost here, we'll click on checkout and it'll bring you to the express checkout page. So even if the clinic is paying for the product and you're collecting payment directly from your patient, you can still ship directly, drop ship directly to that patient. So you'll use this toggle here to upload the patient's information, add in their name, phone number, and address, and then continue. VitaminLab offers free standard shipping for all of our formulas, no matter the cost. So that is through USPS. And a typical timeline to create your customized formula, to custom compound it, encapsulate it, and package it is about 10 business days. So you can expect to receive it anywhere from 10 to 15 business days. You'll see here as well that VitaminLab credit has been automatically added to your first wholesale order. And for those of you attending today, you'll get an extra 25%. So you'll see that on your accounts once you register. That is the tour here of the VitaminLab portal. We have so many great resources available for you to kind of explore our testing integrations. We have a podcast. All the resources are available in this tab here to access. So different ingredient resources. We have monographs that go into quite a lot of detail of our specific ingredients that we source and where we source them from, as well as any practice building materials. We can offer you, brochures that you can have in clinic. We're really here to support you in launching this to your patients because we know this is a new program that you would be offering. So we're really excited to be able to support you in this journey of adding personalized supplements to your practice. So, additional resources that we have available for you here are webinars. We have a great YouTube page, and then I did mention also those portal resources. Next steps would be for you to create an account with VitaminLab. So you can unlock your $120 credit. Your account will be immediately approved, and you can start placing orders right away. If you'd like to deep dive into this a little bit more, you can book a group demo through our booking link. And then you will also be assigned, once you place your first orders, a dedicated account manager who can really provide a great onboarding experience. You may even be lucky enough to get Dr. Lydia or our other account manager, Carolina, who's fantastic and been with VitaminLab since almost the beginning. So I'm going to link some offers here in our chat so that we can have that available for everyone else. And then in the meantime, I would love to see if there's any questions that anybody has.
Yeah, thank you so much, Sarah and Lydia. That was a fantastic, very well-organized presentation. I appreciate that. Our attendees, if you can ask your questions, not in the chat window, but in the Q&A section, that'd be really great. And we'll take them as they come. I see some links coming through in the chat window, and some questions are coming through as well. Lydia, if you'd like, you can go through those questions, or I can read the questions out I'm happy to read these questions out. Shall I go ahead and do that?
Sure, perhaps so everybody can hear. That'd be nice.
Yeah. Okay. Do you have to input the patient demos into the VL portal each time?
By demos, do they mean protocols?
They might mean like their demographics. Is that potentially? So at the moment, so this is version 1 here of our integration with Charm. We are working on collecting feedback on, what we could do to make this a truly seamless integration moving forward. So I think one thing that we would love to do is have, VitaminLab and Charm speak to one another to be able to provide the patient's, name, phone number, and email address so that doesn't have to be manually entered. But at the moment, we do have to enter that in order to send off either the payment email or the invoice. So hopefully that is what they meant by demo.
And Dr. Wheeler, feel free to ask a follow-up question if there was something more specific you needed. Thank you so much for your question. Are we able to adjust our 25% margin through the site, or we have to call to do that?
Yeah. Hi, Natalie. Spoke to you this morning. Glad you could make it. Just email me since you have my email already, or you can email us at practitioners@getvitaminlab.com. I will add this here to the chat. But yeah, at the moment, we don't have the capability to do it directly on the site. Us as the VitaminLab team do that on the back end. So if you'd like to adjust it up or down in terms of your margin, some practitioners would like to, add more discount for their patients' benefit, you can just let us know and we'll adjust that for you.
Thank you. Thank you.
Hi, Sarah. Just really quickly, the stuff you're sending in the chat, it's only sending to hosts and panelists. Can you send that to everyone?
Yes, good call. Thank you so much for letting me know.
Thanks, Mega. Mega always has an eye for detail. Appreciate that, Mega. I had a quick question. Is this only available for practitioners, or can a patient actually log in and be able to avail this?
Can you repeat that question?
Is this only available for practitioners, or can patients also request customized supplements?
Yeah, so we don't currently have a patient portal. Within our practitioner portal, we do offer the ability to therapeutically dose. So we want to make sure that you do have that, patient practitioner relationship when you are recommending a personalized formula. We do also have a direct-to-consumer portion of our website. It works a little bit differently through a bit of a quiz. But, in terms of your exclusivity with your patients, we do offer that private labeling option so that, the formulas are coming from you, the practitioner. The capabilities on the direct-to-consumer site are also just a little bit more limited in terms of dosing and ingredient choice.
Great, thanks for that. A question by Stephen Radowitz. How do we customize the package?
So that would be directly with your account manager or your account executive. You can also email the practitioners at getvitaminlab.com with your logo. There's a one-time setup fee of $100 to get this your label template designed and started up. But you do have that $100 credit available to you. So we can just utilize that $100 credit, apply it to that setup fee, and then you're good to go. Anytime you're ordering through your VitaminLab account, that label will get generated automatically.
A question by Lori Armstrong. If practice labels are provided, will the pharmacy apply the labels when the product is ordered?
Yes, yeah, that will automatically be done. So as soon as you approve your label template, that will be tagged. And then anytime you're ordering through your practitioner portal, that label gets generated. So no additional work is needed after that.
Does free shipping include Puerto Rico?
Yes, I believe it does.
Can we adjust the margin for specific patients or the adjustment counts towards our whole dispensary?
So at the moment, it's just the whole of your account would be adjusted, so it wouldn't be on a per patient basis. Again, if you're needing to do it for a specific account, you can always or a specific patient, you can always reach out to us and we can just do it temporarily. But that is something that we're working on.
Okay. I'm going to go ahead and send these links over. I'm not sure if you had access to sending it.
Yeah, I wasn't able to, so I appreciate that.
Okay, wonderful. So I just was able to send that right now. So hopefully all of you can see those two links that were sent for registration with VitaminLab as well as booking a demo.
And if you're able to also just share the practitioners at Get Vitamin Lab email address as well, that would be great.
Absolutely. Yeah.
Thank you.
Oh, oops, that did not copy. There we go. Let's see. Do we have any more questions before we wrap up this webinar? I just love the fact that you check for contraindications with pharmaceuticals. I think that's great. That's a great feature.
Yeah, we're really excited about that one.
Well, it looks like, yep, it looks like I'm not seeing any other questions. Sarah and Dr. Lydia, is there anything else you'd like to add?
It's really grateful to be here with everybody. And I had a great time at the Charm Conference. I will say that. That was a lot of fun. So thanks for having me there.
Well, that's a great, a segue for the Charm Conference. It is coming up. Megha, if you want to say a few words about it, she and our marketing manager is working fervently on this. Megha, am I putting you on the spot? If not, I can get started. Yeah.
Yeah, I can just quickly go. So CharmHealth is our annual user conference. We're holding it this year. It's August 23rd to 25th in Washington, D.C. And I can put information about the conference, but this is just a really great way to, train with the CharmHealth team to see how you can use the EHR for your practice, and also, meet some of our wonderful partners who hopefully, VitaminLab could be there. And if you have any, you can also meet them as well as our other partners who are integrated with us. And let me put this information here. I think, Ranjini, I can't send it to everyone. So if you could,
you can go ahead and send it. Yeah, and I'll go ahead and send it to everybody.
But here you can find more information about the conference. And right now we're having an early bird registration, which ends.
Yes, take advantage.
So if you are interested in coming to CharmHealth, now is your chance to get tickets at a discounted price.
We really try to make the CharmHealth tickets affordable, so all our practitioners can come and take advantage. And it's just a fantastic event. And, we have developers coming over from India. We have an innovation challenge. You can see, CharmHealth is really rebranded with our marketplace and, trying to be at the forefront of digital health with attracting startups and innovators to our marketplace. So you're in really good hands, just having CharmHealth as your EHR, and just we're really excited about, for example, our VitaminLabs integration, and you'll meet other startups and as well that are potentially integrators with CharmHealth or that may be in our marketplace as well. So just a great place to network as well. So thank you so much. And with that, if VitaminLab has nothing more to say, I will conclude this webinar. We hope you found this session creating a truly personalized formula with VitaminLab and CharmHealth both informative and engaging. And I'd like to remind you that if you have any further questions or need additional support, you can contact us at support@charmhealth.com. And for specific inquiries, and as you know, you received the email to contact VitaminLab. Their team is available and ready to assist. Please take advantage of their special offer. It is only available to the attendees that came here today. And I think in general, you do get a $100 discount. You can correct me if I'm wrong, but this is an added $25 to that. We appreciate your participation and your wonderful questions. Stay tuned for this recording of this webinar, which will be shared out soon. Thank you again for joining us. We look forward to seeing you at our next CharmHealth webinar, and really would love to see you in person at the CharmHealth Conference in DC. So thank you so much. I appreciate it.
Thanks, everyone.
Thank
you. Yeah, see you all.